I've evaluated thousands of type 2 diabetics over the years, and the one thing that I have found that they have in common that is linked to the underlying cause is toxicities. Now, there's different types of toxins that we evaluate for, things like mold toxicities, things like heavy metal toxins, and environmental toxins. And today we're going to be discussing how environmental toxins have an impact on the body that is driving type 2 diabetes. Now, as a reminder, we know that type 2 diabetes is not a blood sugar problem. Many of you may be thinking, oh, it's because of my elevated sugars, and that's the reason why I have type 2 diabetes. That is not the reason why you have type 2 diabetes. That is a symptom of your type 2 diabetes. Type 2 diabetes is a cellular disease. Our cells have these doors that open and close to allow the sugars to enter from the bloodstream into our cells because that's where our engines are. Remember, sugar is our fuel, and we need to get it into our engines. The problem is there are issues that develop in the body that start closing down those doors, and then when enough of those cells are damaged, the sugars start building up inside the bloodstream because they can no longer get themselves into the cells, i.e. elevated sugars, and the person gets diagnosed with type 2 diabetes. So today we're going to be discussing how environmental toxins play a role in that process, because what we know about environmental toxins is they have been shown to cause cellular damage, literally blocking the ability for you to have normal blood sugar regulation at multiple cells. Now, when this happens over time, you start to cause more and more and more damage that, again, like I mentioned before, pushes those sugars back into your bloodstream, causing those elevated sugars. Now, the other thing about environmental toxins is they will not only directly cause cellular damage, which means it's a direct link to your diabetes, but they can also impact other areas as well. Now, before we move on to this test here that I'm going to show you here, if you'd like to learn more about how you can help yourself with type 2 diabetes, make sure you click my link below to download my diabetes guide. It's filled with information that'll be beneficial to help you today start learning what you need to do to start reversing your own diabetes. Now let's go over this test here. We can see we have this actual patient test here. Now, I've protected them from their name, obviously. But we can see here we're looking for environmental toxins. Now, there are multiple types of environmental toxins. And how do we get exposed to these environmental toxins? Well, it can be things that we like drinking out of water bottles, right? Plastic water bottles. It can be things that we're exposed to through car emissions, the air we breathe, the food we eat, things we consume oftentimes can have these environmental toxins, and they can get stuck inside our body because of the inability to get rid of them. And as more and more of them start to engulf your tissues, they start causing more and more cellular damage, progressing into conditions like type 2 diabetes. So we can see here's a couple of different types of toxins right here. The first one we see here is called 4-nonphenol, and as well as called BPA. Now, as just so you know how to read this test, anything you see in the yellow or the red is considered toxic to the body, which means it's now stuck inside the body. But 4-nonphenol is what they use in things like paints, pesticides, cosmetics, even in plastics. And BPA is what they use to make plastic, anything with plastic. Both of these toxins have been known as endocrine disruptors. Now, this is a very important concept I want you guys to understand here, because if we talk about this or ask the question, who is the doctor that specializes in treating type 2 diabetes? They're called an endocrinologist. You may have known that. Because an endocrinologist specializes in the endocrine system, which includes blood sugar regulation. So when you have an endocrine disruptor, like we see here, this means it's blocking the ability for you to have normal blood sugar regulation. So essentially, when you see these types of toxins in your body, they're direct causes to your diabetes. Very important, because if you have these toxins and you're a diabetic and you're only trying to do things with lifestyle, it's never going to fix it. You're going to get sicker, you're going to get worse, because these are going to drive the underlying problem. Here are multiple others, right? So we can see things like atrazine. Atrazine is an herbicide. It's a weed killer. They spray these on our food. They spray them on golf courses, residential lawns, gardens, etc. And again, look at this. They are endocrine disruptors, which means it's a direct link and cause to type 2 diabetes. We can see here are two more. Glyphosate. Glyphosate you may be familiar with. It's the common herbicide that many people have used or are familiar with, I should say, in regards to Roundup. So this is what they use, the main toxin found in a product called Roundup that people use on their gardens to kill weeds. They spray it on our food supply. Again, look at this. It's a direct cause to type 2 diabetes, but it also causes kidney disease. Renal stands for kidney. If we scroll down here, we have another toxin here called TG. Remember, like I said earlier, the goal in the body is to get our sugar, our fuel, into our cells. Well, into our cells, we have our engines, which are also referred to as mitochondria. If your sugar never reaches your mitochondria, you don't function as a human being, and when enough of those cells are damaged, you die. And that's why we see diabetes killing people early in life. But with this toxin, it's such a bad, harmful toxin, it not only blocks the ability to get the sugar into the cell, but it also blocks when it inside the cell at the engines or the mitochondria, which is why this toxin is directly related to what? Can you guys see that? Diabetes. It's a direct link to your diabetic condition, as well as Alzheimer's. And for those of you who don't know, type 3 diabetes is Alzheimer's. So this is a mechanism that's driving both of those problems in the body. Here's another one on this individual. It's NAE. This is found in things like plastics, food packaging, cosmetics, dyes, treatment of drinking water. It causes neurological damage. So for those of you who are dealing with things like neuropathy, this could be an underlying mechanism because it'll damage and destroy the nerves. It's also been linked to cancers as well. Here are 3 others here. We can see butylparaben, methylparaben, and propylparaben. These are antimicrobial agents in things like cosmetics, makeup, moisturizers, hair shampoos, conditioners, etc. They are linked to things like leaky gut, right? You may be aware of the term leaky gut, but what is leaky gut? It's where toxins like these guys, they actually get themselves into your guts and start disrupting the ability for the gut to do its job, which is absorption and digestion. It can lead to things like nutrient deficiencies, inflammation, a lot of GI issues because these toxins are also linked to other problems. So not only do they impact your cells, not only are they linked to type 2 diabetes, but they can cause other areas to be damaged as well. And again, here we go again. These are endocrine disruptors, which means direct links to the type 2 diabetes. Here are 3 others, a few others here. DDA. DDA, which is interesting here because this is a metabolite of DDT, and many people know what DDT is because it was a common pesticide that was used in an insect control. I say used to be used because it was a common one back in the 70s and prior. Many times people may realize this because they used it for things like mosquitoes. They would drive a truck down the road and it's spraying out the sides. Well, what we now know is DDT is actually an endocrine disruptor. So it actually is linked to conditions like type 2 diabetes. So many people who are exposed maybe in the 50s or 60s, they're still dealing with it today. And so we have to understand these toxins don't necessarily have to be exposed today. You could have been exposed 10, 20 plus years ago, sometimes even longer. 3-PBA and things like DP, DTP, and DMDTP, these are your organophosphates, your insecticides, your pesticides. They spray these all over our foods. We're consuming these things on a regular basis when you go to restaurants or when you're eating foods that are not organic. Now, if you're eating foods that are organic, fantastic, but have you been doing that your entire life? That's not likely the case. And remember, these are lifetime exposures, but we can see it impacts the nervous system. It can cause things like memory and concentration issues, causing things like type 3 diabetes symptoms, right? So these are very damaging symptoms. Now, oftentimes we don't see every single one of these symptoms being expressed, but as things persist here, we start seeing more and more of these developing over time. Look at these toxin levels, guys. This is not uncommon to see, by the way. So we can see things like HEMA, which is found in things like agricultural detergents, pharmaceuticals, cosmetics. They cause liver damage. Remember, the liver is heavily involved in blood sugar regulation. If your liver's not working well, not only will you not be able to detoxify these toxins if it's sick, it's basically destroying the organ that's required to get rid of it, but also it's directly linked to your diabetes. So these are not uncommon to see. 2-HIB, this is an additive they put in gasoline to increase the octane. So when you go to the gas pump and you see 87, 89, 91, this is what we're seeing, the type of toxin there. What does it cause? Liver damage. Hepatic means liver, by the way. Kidney. This is dangerous, dangerous stuff, guys. And many of you are dealing with these toxins and you don't even know it because you haven't been evaluated. 2-MHA, 4-MHA, these are things found in pesticides, fuels, perfumes, detergents. Again, they impact the nervous system, right? And they're very damaging to the body. And we can see a whole other slew of them as well. But here's the big picture. When you're dealing with this type of toxins, they're negatively impacting your body. They're driving cellular damage. And when enough cells are damaged, you get diagnosed with type 2 diabetes. So let's unshare this real quick and think about this. If these are the underlying mechanisms that are driving your cellular disease, why aren't you being evaluated for this? Why aren't you being tested? And here's the reality. Because there is no pharmaceutical drugs to address these. Remember, the medical model, if there's no medications, surgery, or injections, they many times can't help you. So as these problems persist over time, you start developing symptoms like elevated sugar, elevated cholesterol, blood pressure starts to go up. And the treatment is giving you pharmaceutical drugs to address the symptoms while these specific problems get worse and your disease worsens over time. So unless you're being properly evaluated and getting a customized solution to these issues, and by the way, can these things be handled? Can we get these out of your body? Get them into a stabilized situation? Absolutely. You can do this if you know the right steps and you go to the right practitioners who can evaluate you and put the customized solution. It has to be customized to your needs, not a one-size-fits-all approach. But here's the thing. If you want to learn more about how we help individuals, how we test, the specific protocols that we do, make sure you watch this next video here because I go into detail in the specifics of how we help individuals with their diabetes, essentially reversing their type 2 diabetes. I look forward to seeing you there. Take care.